Group Florence Nightingale is an institution within Turkey providing safe and modern medical services, being the pioneer of innovations for more than 30 years. The group has been named after Florence Nightingale, who had first defined the sanitation rules and hence has started modern nursing. The first hospital of the group was opened in 1989. Then soon after, Gayrettepe Florence Nightingale Hospital opened up, followed by Kadıköy Florence Nightingale, then Göktürk Florence Nightingale medical centres were brought into service. Istanbul Florence Nightingale offers services in advanced treatment standards through its green and smart building technology for a healthier tomorrow. Ataşehir Florence Nightingale, which serves in almost every branch, has a total of 102 beds, 10 adult intensive care beds, and 9 neonatal intensive care beds and 4 operating rooms. Kadıköy Florence Nightingale Medical Centre provides international patients with services of all specialities, with outpatient diagnosis treatment, fully equipped radiology and angiography department, 300,000 outpatient examinations and 50,000 inpatient treatments have been performed with the capacity of 800 beds, 41 operating rooms and 123 intensive care units by the group hospitals. The group has reached the position of being the centre of reference for many branches in Turkey, the Middle East, North Africa and Central Asia. Every day successful treatments are being performed with the best outcome. In cardiology, cardiovascular surgery for adults and children, the interventional cardiology, on average 1,200 operations are being done at the Orthopedic, Traumatology and Spinal Surgery Centre. 25,000 orthopedic, 3,700 spinal surgeries and scoliosis in particular have been successfully performed to date, with its EOS device, which performs a 2 or 3 dimensional screening of the skeleton by using an ultra-low dose of radiation. Florence Nightingale is one of the best among the Turkish hospitals and spinal disorders. The group sets itself apart for its advanced oncology centre. Modern technologies like True Beam Rapid Arc, intensity modulated radiation therapy, PET MRI, and second-generation sequencing devices are used every day by its experienced staff of doctors in this field. Thanks to the Gamma Knife Perfection technology, opening the skull is not necessary for vascular lesions and tumour cases, so the patients can return home on the same day. More than 1,200 liver transplants, nearly 800 kidney transplants, 400 autologies, 350 allogenic with a total of 750 bone marrow transplants are performed at the Comprehensive Transplantation Centre. The Da Vinci surgical system was used for the first time in Turkey in Florence Nightingale Hospital in the year 2004. Today, Da Vinci, heart and lung surgeries are performed comfortably without opening the chest, and prostate surgeries are performed comfortably without opening the abdomen. The Neurological Sciences Centre offers services in neurology, radiology and neurosurgery at the international standards as done in the selected medical centres around the world. Chemoradiablation is performed with great success in interventional radiology. Inaccessible tumours and lesions are treated without surgery by chemoradioembolization and radiofrequency ablation. The Immunology Human Cell Oncology Genetic Diagnosis and Research Centre continues to be the leader in its field. Patients are being treated with the newest technology and methods at the Obesity and Metabolic Diseases Centre. Florence Nightingale is one of the most preferred hospitals in the country in the fields of plastic surgery and dermatocosmetology. Along with providing medical services, the group educates expert medical staff in Demiroğlu Bilim University, the first medical university in Turkey. The students receive multidisciplinary training in the modern conference room via live transmissions from the operating rooms. The group has accreditation certificates of German TÜV, British QHA, and American Joint Commission International, and continues to be the best pioneer of innovations in many areas and branches with its experience of more than a quarter of a century.